As soon as they're admitted, we get an automatic trigger that comes through our system, Epic, for us to come see the patient. We assess them within 48 hours, come up, see how they're doing, how they've been eating, pretty much how their nutrition life has been prior to coming in. Go from that point on, do we need to start supplements? Do we need to do something at this point? Or most of them, they're doing okay, they're eating well. Then we just kind of follow them about every 2 days to check in, see how everything's going, because we want to be on top of something. If the appetite's going downhill and hasn't been doing very well, for a few days, we need to be on top of it. Well, it's very important because they've got to keep their strength up. They're here for a little while, and we don't want them to. Most of them have already lost weight.
From the chemotherapy?
Yes, previous or just prior to diagnosis, they've lost weight. They're losing muscle mass, and we want to keep them as strong as long as we can. And while they're in here, we want to keep them built up. I expect them to not eat well for a while. That's expected. That's normal. That's okay. But I don't want it to go on for too long to where it's something that it turns into an issue where they go home with this problem. I want them to go home as good as they can be. No fresh fruits, fresh vegetables, anything like that. They can have it if it's cooked, or canned, or they can have applesauce. They can have canned mandarin oranges, canned fruit, cooked vegetables.
Orange juice or no?
Yeah, they can have. It's got to be pasteurized. So anything, the neutropenic diet all entails, because it's higher counts of bacteria, the pesticides, all that. We don't know who's touched the fruit. All of that, and so these people that are coming through, even other chemotherapy patients, but especially the stem cell patients, their white blood cell count, which is what fights infection for them, plummets to nothing, and they can't fight an infection. So we don't want someone to develop a foodborne illness that they cannot fight off. And it's a very controversial, the neutropenic diet, if it is needed or not needed, but here we kind of just play it safe that it's better, it's not going to hurt you to not have the fruits, fresh fruits and vegetables for a month or so. We would rather keep you safe than, have that one instance where, you did get, contract something from the food. My focus would be protein, making sure they're eating enough protein, enough calories in general. And at that time, sometimes I say, if you eat ice cream and hot dogs all day, I don't care. I get to be the good dietitian sometimes because I just want you to eat. That's my main point. It's a patient that they come in and they might be feeling great, and I just want them to be aware that when they do come in, even if you feel well, you're probably not. That's going to feel well eventually within a week or so, and that's okay, and that's normal, and that's expected, and we're all prepared for that, and I don't want them to worry. And that's a point I get across, that if I'm not worried about you, I don't want you to be worried. So just ride it out, and it will, it'll be okay in the end, and we'll get you back before we send you home. It's a whole spectrum of care. I mean, from the instant that they're admitted, all the ancillary departments and they're consulted. Like, I'm consulted immediately, and I'm up here, like I said, within 48 hours. I've seen them, I've assessed them, I've gone over their diet education, I've talked with them, any questions, concerns. I'm very involved with the nurses, with the doctors, the NPs, the PAs, everybody. We're all, in this together and working to get this patient okay. And if something isn't going right, then we get a hold of each other. We communicate very well. That's one thing I like about working on this floor.